Hi everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. So in my work with my clients, I help them use both food and lifestyle as a way to help them improve their symptoms and live comfortably with their autoimmune disease. So May, if you're watching this as I post, it's May, and May is Celiac Disease Awareness Month. Celiac disease is an autoimmune disease that affects the small intestine and is one of the only autoimmune diseases that is treated by diet alone, which I think is pretty cool. So today I'm covering what this disease is, how it's diagnosed, how it's treated, and other special nutritional issues to consider. Before I jump in, I just need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes you make to your medical care. Okay, so what is celiac disease? Like I mentioned, it's an autoimmune disease where eating gluten can lead to an immune response against the small intestine. This immune response causes inflammation and wipes out the villi lining the small intestine. Damaged or eliminated villi impact the absorption of nutrients. So people with undiagnosed celiac disease can kind of realize a host of other symptoms and conditions, including things like early onset of osteoporosis and osteopenia, heart disease, struggles with fertility or miscarriages, iron deficiency, anemia, gallbladder and liver issues, malnutrition, neurological symptoms, vitamin and mineral deficiencies, and cancer. So celiac disease is hereditary. If you have a first-degree relative with celiac disease, you have a 1 in 10 risk of developing this autoimmune disease. And this autoimmune disease, again, can be diagnosed at any age. The later in life that it's diagnosed, the higher the risk is of developing a second autoimmune condition. So how is it diagnosed? Well, while gastrointestinal symptoms are usually the most obvious, celiac disease has some other not so obvious symptoms. Some of these may include fatigue, weight loss, anemia, which means that you're low in iron, loss of bone density, mouth ulcers, joint pain, damage to tooth enamel, irritability, and failure to thrive in children. There are a few tests that help confirm a celiac disease diagnosis. And actually, this autoimmune disease is one of the few that have a very specific kind of order of blood tests and ways to definitively test to see if you have celiac disease, which is kind of nice. So the first kind of way to test is by using a blood test. There's something called tissue transglutaminase, IgA test, or you may see it on your lab as IgA-TTG. So when celiac disease is present, the immune system makes antibodies that attack an enzyme in the small intestine called tissue transglutaminase, or TTG. So if these antibodies are present, celiac disease is more likely. This is the most sensitive test for celiac disease, but the person must have adequate immunoglobulin levels, or IgA levels, for this to be accurate. Some people don't have enough IgA, and then they can't really use this test because it's not as sensitive. So then the second option for those people who don't have a robust IgA levels is something called deaminated gliadin peptide antibody test, or IgG-DGP. This is a less sensitive test, but used when an individual does not have adequate IgA levels. So DGP is an immune-dominant peptide that activates the immune response in celiac disease. So if either of those blood tests come back as positive or potentially positive, borderline or positive, usually the doctors will then recommend a small intestinal biopsy. So this is done as an upper GI endoscopy. They use a camera and kind of go down through your mouth into your small intestine, and they look at the lining of the small intestine, and then they also take a tissue sample to analyze, and they can tell whether or not autoimmune disease or celiac disease is present by looking at that tissue sample. Lastly, there is an option to do genetic testing. So some doctors may do this if someone has been not eating gluten for a long time. So in order for the blood tests to be accurate, you need to have been eating gluten. So if you have been gluten-free for a long time and then you want to get tested, you either have to add gluten back into your diet or go straight to an endoscopy, which again won't really tell you much, because if you're not eating gluten and you have celiac disease, then you will have villi present. So they may do genetic testing. And again, it's not a definitive test, but they look for gene variants called DQ2 and DQ8. So if you do not have those variants, it's unlikely that you have celiac disease. However, if you have either two of those variants, there is a possibility that you have celiac disease, but it doesn't mean that you have it either. So it really just depends. So what's the treatment? So celiac disease is treated entirely with diet. Those with this disease must remove gluten from their diet. Gluten is found in a lot of products, including breads, pastas, baked goods, soy sauce, and processed foods. It's also hidden in many processed foods, such as food starches, flavorings, preservatives, and stabilizers. Cross-contamination is a huge issue for those following a strict gluten-free diet. So it's recommended to have separate dishes, cookware, ovens, toasters for gluten-free foods. One expert said to treat gluten like raw chicken, so you must clean everything it touches. Going out to eat can be extremely challenging too. Thankfully, there are gluten-free restaurants opening up all around the country. I was just in New York and had some delicious gluten-free food from, strictly gluten-free restaurants. And there are actually some here in the Bay Area as well. If you do plan to eat out, please make sure that you call the restaurant in advance to see if they can accommodate you. You want to treat gluten like a severe allergy and ask that all your food be cooked separately. So celiac disease can cause some other issues. So there's some other nutritional things to consider. Because it can lead to nutrient deficiencies because of the villi damage, at least at the onset of diagnosis, you do want to double check to make sure that your micronutrient status is up to par. So key nutrients that you may want to consider supplementing that tend to be lower in this population include iron, B12, calcium, vitamin D, folate, and zinc. You also want to do ongoing monitoring while you are following a gluten-free diet for things like making sure you're getting enough fiber, B vitamins, iron, calcium, vitamin D, zinc, and magnesium. Many of the gluten-containing foods contain these vitamins and minerals or are fortified with them. So one way to ensure that your diet includes all of these key nutrients is to eat plenty of fruits and vegetables and gluten-free grains like rice and quinoa. So just to recap, today we focused on celiac disease, what it is, how it's diagnosed, how it's treated, and other nutritional considerations to consider. If you are struggling with your autoimmune disease and you think you'd like more help, please reach out to me and book a free discovery call. The link is in my YouTube profile. We can just have a quick chat and make sure that I'm a good fit for you and learn about your goals and to see, if I can help you. Also, if you are looking for more information on managing your autoimmune disease, please go to my website, andyrubin.com. I have lots of free materials that you can download to discover ways to reduce inflammation by, eating an anti-inflammatory diet, helping your body detoxify, those types of things. So check that out. Lastly, in my YouTube profile, there is a link to sign up for my newsletter. It comes out every Thursday into your inbox. I'm always kind of helping people get more information about managing their autoimmune disease with both food and lifestyle. So sign up for that. If you don't like it, you can always unsubscribe. You will not hurt my feelings. So thank you so much for joining me today. If you enjoyed this video, hit the little subscribe button. These come out about every week. I'm always here trying to help you learn different tips and tricks to manage your autoimmune disease and hopefully live the life that you should be living. So thanks for joining me, and I will see you next time.